back, my friends, and happy Friday. This is Lindsay coming at you with more work from home job leads. I feel like it's been a few weeks or a little bit of a hot minute since I have done one of these bigger healthcare job videos. I know that is what a lot of people are looking for. So today we have 9 healthcare jobs that are hiring right now, work from home in 2022. These are all for my United States folks only. And of these 9 positions, most of them are non-phone, which I know is what everyone is looking for. Only 2 of the 9 have to do with being on the phone at all. And as always, the links to everything is in the description box below. And those 2 that are phone-based, I do believe I have them tagged in the description box as phone-based. But as always, I ask that you enjoy these job leads. Please like and share this video. That helps me out and gives me direct feedback that I am helping someone and these job leads are being helpful. But with that being said, I know I can get long-winded, so let's not waste any more time. First up, we have Ventra Health, and they are hiring a chart research representative. Now, this is full-time, remote, so they're looking for someone to review emergency hospital medicine medical records for necessary documents for proper indexing. So you'll ensure that the medical records are complete with the electronic medical record system. You'll conduct review of the system, exam, HPI, NMD, or doctor notes. You'll retrieve existing medical records from their electronic medical record system. You'll scan and input any documents that need to be put into the system. You'll verify that the information is categorized and indexed appropriately. You'll pull medical records through automated tasks. You'll monitor those performance of those automated tasks, and you'll document work processes as required. Now, they do not require any college degree. They are only requiring a high school diploma or equivalent. They do want somebody who has 1 year experience handling patient information or medical records is preferred, but not required. So this job is for you if you have working knowledge of medical terminology, working knowledge of department roles and responsibilities, especially working with electronic medical records, strong critical thinking skills, great organization and time management skills. And of course, we've talked about this a lot in my healthcare videos. Healthcare is always going to require you to be familiar with the Microsoft Office or Google Suites, the word processing, Excel, spreadsheets, databases, and then even presentation software such as PowerPoint. Now, unfortunately for this position, they did not list the salary. That will have to be discussed at the time of the interview. A lot of places, because they are hiring remote within the United States, salary is always dependent not only on the experience you bring to the table, but also your state location that you are in. Next up, we have the big health insurance company, Cigna. They are hiring a claims appeal admin rep. So an administrative rep will be responsible for monitoring incoming appeals, conducting the intake process of new appeals, including gathering and filtering data, determining the eligibility of appeals, compiling and reconciling the inventory, and of course, performing any other duties as assigned. They don't require any college degree either, only a high school diploma. They prefer experience in the healthcare field, but that is also not required. Again, you have to have Microsoft Office application experience. Now, this position is a work from home. You need to bring your own internet connection, and they offer a pay rate of $17 an hour all the way up to $21 an hour, depending on, again, your location and experience. And they also offer a benefit package including medical, dental, vision, and 401k and paid time off. Next up, if you already have a little bit of healthcare experience and you're just trying to advance into a more advanced role and you want to make lots of money, being a billing supervisor is where it is at, and United Healthcare is hiring one of those. And again, it says you can telecommute from anywhere in the United States. So for their billing supervisor, they're looking for someone to plan, monitor, and evaluate the functions of the financial services department to meet performance goals. You will also be responsible to provide training and direction to your staff. You'll have to identify problems and identify solutions for those problems and workflows and processes. So you'll create and follow SOPs to ensure compliance with government and organizational billing guidelines and policies. You'll review and approve departmental activities. You'll audit, identify, and report billing and collection trends. And you'll make sure that job aids are available for account resolution. Now, again, this is great for people who have healthcare experience. They do not require any college degree. Of course, it is always preferred, but the only actual requirement is a high school diploma or GED. They do want somebody who has 1 year experience in the field of troubleshooting, again, knowledge in Microsoft Office and Excel programs, someone who has healthcare experience, and someone who has a solid work ethic. But if that is you, being a supervisor is a big promotion with a big pay range. Now, of course, pay is always dependent on location and experience, but this position starts out at around $54,000 a year and goes all the way up to $106,000 a year. So if you have healthcare experience, this might be worth applying to. Next up, if you don't want to be a billing supervisor, but you do want to be in billing, Change Healthcare is hiring a billing specialist. Now, their billing specialist, they are looking to be responsible for a variety of tasks, including Medicaid claims submission and denials management. So you'll ensure the billing inventory for all assigned clients is managed, and you'll be responsible for timely and accurate billing of all accounts. You'll be responsible for entering Medicaid eligibility into the system. You'll be responsible for denial management of all assigned claims to you. So you'll have to analyze all the EOBs or remittances to ensure accurate payment has been received from the insurance companies. You'll assist the manager as needed in preparing monthly status reports, and you'll also assist with high severity requests and issue escalations. Now, they are looking for someone who has 3 years experience in billing and denial management, preferably with Medicaid, 2 years experience in Medicaid or government AR follow-up. They do need a high school diploma or GED, but no college degree is required. Again, they want someone who is familiar with Microsoft Office and PowerPoint, someone who has great customer service skills, great organizational skills, and the ability to think logically and critically. Moving right along on the billing follow-up side, Navient is hiring a coding denials specialist. Their coding and denials specialist will be responsible for accurately coding at least one of the following service types: outpatient facility, emergency room, outpatient surgery, and observation claims. So you'll be assigned 2 types to be the coder and denial specialist for. And so you're going to have to code these claims and do project work. You'll have to keep records of what you code and completion of time daily reports. You'll have to do analysis and reporting to identify trends and report those to the manager. And you may have to do a little bit of customer service here and there, communicate with insurance companies or even providers to get correct coding. They do want someone who has a high school education and someone who has 5 years experience with coding, billing, or in the healthcare revenue cycle. Someone who can complete a pre-employment medical coding assessment, so there will be a quiz or test before you are hired. Now, these next 2 positions are the ones that are more phone-based. So Cigna is hiring a physician support unit representative, and that person will be responsible for watching the phone queue to maintain awareness of when volumes of calls are high, and during these times the role must not go on after call or administrative time. So you'll be educating callers about health plan requirements for pre-authorizations, reconsiderations, and appeals. You'll work with sites, patients, and physician offices to investigate and resolve any issues for pre-certifications, and you'll have to transfer the calls to other departments when necessary. So you need to make sure sure you'll be giving professional and accurate information to callers. Now, this does require a high school diploma or GED, but no college degree. Someone who has previous customer service experience, medical experience, someone who has data entry experience, or someone with excellent communication skills fits the qualifications for this position. They also need someone who can adapt quickly in a fast-paced environment. And this position does pay $17 an hour all the way up to $21 an hour and includes a standard benefit package, vision, medical, dental, 401k, and paid time off. And Previa Health is hiring a billing resolution specialist, and this is our other phone position. They are paying $17 an hour, and they are looking for someone to specifically work 9:30 in the morning to 6 p.m. Eastern Standard Time. So you'll have to convert that to your time zone to see if those hours work for you. But if they do, they are looking for someone to answer a high volume of inbound phone calls from patients using a cloud-based phone system. You'll be educating those patients on their patient financial responsibility surrounding their deductibles, copays, and co-insurances. So not only will you inform the patients of those, but you'll also be collecting the patient balances using their financial policy guidelines. You'll research, identify, and resolve any billing issues that the patients have, and you'll have to meet call center productivity and quality standards. Again, they require a high school diploma. They want 1 to 2 years of experience in a call center or customer service environment. Someone who is familiar with software such as G Suite products. You have to be able to work an 8-hour shift and have a quiet place in your house to work. Moving right along, if a phone work is not your thing, Health IQ Precision Medicare is hiring an enrollment specialist. An enrollment specialist will be responsible to update the company database by inputting information from each call and keeping the customer field current. You'll respond to agents' requests to administer a quiz. You'll respond to inquiries to resolve potential client issues. You'll track record of achieving measurable results, and you'll process policy corrections as needed. They are specifically looking for someone who has great attention to detail, great organizational skills, someone who has a high school diploma, and strong computer skills with a positive attitude. And last but not least, we have Lyra Healthcare hiring a client support specialist. Now, they are looking for someone to work weekdays and weekends. In this position, you'll be responsible for conducting needs assessment, answering benefit and product information. You'll have to demonstrate strong time management skills with flexibility in fielding unexpected throughout the workday. You'll prioritize client safety and well-being. You'll work in a structured team environment, and you'll engage in feedback and frequent self-assessments of strengths and areas for growth. They are looking for someone who has a minimum of 1 year navigating mental health system, more specifically case management, patient advocacy, crisis hotlines, peer counseling, or any other relevant experience specifically in the mental health field. They want someone who has great writing skills and who can provide clear information with a warm and friendly tone. And they are looking for someone who can demonstrate strong skills and understanding of technology and the ability to use new technology and platforms quickly. Now, their hours are a little bit different. It says shift hours will be a combination of the following. You can select which hours you're available to work in the application questions and processes. So they have different shifts. One is 11 a.m. to 8 p.m. Pacific Standard Time. One is 9 a.m. to 6 p.m. Pacific Standard Time. And another one is 5 a.m. to 2 p.m. Pacific Standard Time. They are looking for have people start on Monday, November 7th. And then they have another training class starting on Monday, November 14th. So get those applications in because they will be doing interviews so that they can get you ready to start in November. All right, if you've made it to the end of this video, I want to say thank you so much for watching and supporting me. As always, please feel free to leave in the comments anything specific that you're looking for because I'm always reading those and keeping that in mind. And I'll be back really soon with more work from home job leads just for you. 2 videos will be popping up on your screen. One I picked for you and the other YouTube picked for you that you might enjoy next. Please subscribe and hit the bell icon so you never miss another work from home or money making video from me. Thank you so much for watching, and I'll catch you in the next one.